My name is Marc Darrow. I practice prolotherapy. I've treated thousands and thousands of patients over the years. The reason I do prolotherapy, it worked on me and it works on my patients. Prolotherapy is a surgical alternative that reduces or eliminates pain. We inject the area of the injury, typically with dextrose and lidocaine, to stimulate an immune response to bring cells to the area and rejuvenate the tissue. The advantages of prolotherapy over surgery are many. Number one, it's less invasive. Number two, it's less expensive. And number three, there's virtually no recovery time. The video you're about to see contains prolotherapy in action. If you have any questions, feel free to contact me at 1-800-REHAB-10 or my website, www.drdarrow.com.
That, and he listens. He listens to everything. He asks you a lot of questions, and he listens, where I don't always get that feeling. Severe tendonitis, and the only thing that had been offered to me was anti-inflammatories, and it wasn't helping, and it wasn't good for me. I don't want to have shoulder surgery. Right. That's a bad surgery. I don't want to go through that, and I'm not even sure it would take care of it.
This is an 80-year-old female who presents with a 2-year history of right upper arm and shoulder pain. The last 6 months became so painful she decided to have prolotherapy. As you can see here, I'm injecting into what's called the glenohumeral joint. That's the shoulder joint. Very simple, fairly pain-free injection to do. And the patient's tolerating this very well. When the patient came in, she brought her MRI that showed that she had rotator cuff tendinosis, which means a wearing down of the tendon, and also her acromioclavicular or AC joint was somewhat worn down, and also she has a subdeltoid bursitis, and that's where I'm just injected into. Here there's pain on the back of the humerus or arm bone where these muscles attach. That's the teres muscle that attaches there, and we're injecting there also. Very simple procedure, as you can see. What we're doing here is alleviating the need for surgery. We would much rather use a prolotherapy injection to grow back the tissue to stimulate inflammatory response, bring fibroblasts to the area, rather than cutting tissue out. The last thing we want to do is destabilize the area. The anterior portion of the shoulder was tender when I pressed on it, and we're injecting now around the subscapularis tendon, which moves the arm inwardly toward the body in internal rotation. And although there were several injections performed, this patient did very well, fairly pain-free, as you can see. And what we're doing is stimulating again more tissue growth and rejuvenating the tendinosis that was found on MRI. This will thicken up the tendon. Studies show that when we do this process of prolotherapy, the tendon gets about 50% thicker and about 200 to 400% stronger.
Before, I tried everything. I knew acupuncture, everything, and nothing really helped that much. With this, when I get the shot, there's relief. I have already recommended the prolotherapy to people I think could benefit from it. There are times when you have to have surgery, but there's lots of times when you shouldn't have it.